Kristin. I'm a physical therapy student from Lebanon Valley College, and I had the opportunity to participate in a clinical experience here at Robbins Rehabilitation. I am interested in outpatient orthopedics with a manual-based approach, which is exactly what Robbins gave me here. I've had a lot of opportunities to work with different therapists at this clinic, and they're all very willing and very knowledgeable to help teach me techniques and any other styles. All of them are very unique and very willing and open to let me practice anything on a daily basis that I think I may be struggling with, learning new manual techniques, and learning their overall philosophies and the way they practice. Robbins is very unique in their style of treatments. Every approach is one-to-one on patients. You spend a lot of time with your manual techniques, and everything is supported by evidence-based practice and exercise interventions to support those manual techniques. Most patients are very happy with this plan, and we don't just look at only the symptoms that they come in with. We actually look at the underlying dysfunction of the problems that they have. We treat what their problems are, getting them in, get to the bottom of the problem, and move them on to things that they can do at home on their own, which is what physical therapy should be. And I have learned to embrace this philosophy here at Robbins, and from day one, this clinic was unique in that way. Not other clinics do this. A lot of clinics look at just the symptoms, get the patient feeling better, and get them on their way, and in 6 or 8 months they might have the same problems come around and they're back again for the exact same thing. At Robbins, they try to look deeper into this and do more looking into the functional problems that they present with. My clinical experience here has been great because I've had the opportunity to work with a lot of different therapists and a lot of different instructors. My clinical instructor catered my needs to what my weaknesses were here in the clinic, and I got a very individualized experience working with patients that I know I needed to work with. I now feel confident enough to walk into a treatment room for pretty much any patient type and feel like I can efficiently and effectively treat any diagnosis at this point in a competent and professional manner without hesitation, and that was something that I had a problem with prior to coming to Robbins. Robbins helped to teach me many of the fundamental concepts of physical therapy practice, and I feel very confident in the skills that I have now. I look to go into more orthopedic practice in my future and use the things I've learned here at Robbins in all of my future clinical practice. It's a good basis for treatment, and having the foundation of the strong manual therapy skills I'll use for the rest of my life. Working at Robbins is like working with a family. They have great community outreach programs, they have awesome community ed. Every month there's marketing and management meetings, so being part of the company is actually part of being in a successful company. You can market, you can make it what you want it to be. Everybody around is trying to better themselves. Everybody's going to continuing ed, everybody's doing things to make themselves better, and everybody teaches everybody else these things. It would be awesome to be able to work for Robbins if I could in the future, or just apply this to any of my future clinical practice. It's a great place to have a clinical experience, and I highly recommend Robbins.